Okay. Thank you. Thank you, Hindi team. Now we are moving to the English session. Today is our 2123rd day of continuous webinar. Today's our guest is Ringu Vishwas. She's MD in homeopathy and
No, doctor. There is a mistake. Today I am doing.
Doctor. Oh, so okay. Dr. Hubert is conducting today. Okay.
That was shared, but unfortunately, you might not.
Yeah, okay. Dr. Hubert is always helping IFPH to make up the make up our session. He's doing a great work. Dr. Hubert is our host and always helping us in emergency situation. Today, what Dr. Hubert will take the class. He is the IFPH coordinator and IFPH moderator, and practicing successfully for many years, and using music therapy in the treatment of with the treatment of homeopathy, and actively participating all the webinars. And I'm inviting our host as a guest of today. Dr. Hubert, you're welcome. Please.
Thank you, Doctor. Thank you, Dr. Ajani. No, still I am also calling you Anjali.
like
Sahani sir.
Many of
Dr. Hubert SILVA, emergency medicine.
Yes, sir.
There are 3% emergency medicine, IFPH, Dr. M.K. Sani, Dr. Hubert SILVA, Dr. Manish Singh Azad.
Yeah. No need of any preparation. They can start at any time. That's a great thing, right?
Thank you, Doctor. Let us have an 1 minute silent prayer. It's the 12th part. Proverbs 15 says, a gentle answer quiets anger, but a harsh one stirs it up. Proverbs 15:2. When wise people speak, they make knowledge attractive, but stupid people spout nonsense. A gentle answer quiets anger, and a harsh one stirs it up. When wise people speak, they make knowledge attractive, but stupid people sprout nonsense. This is what we can see many times in our homeopathic studies, in our college days. Some words we will hear from there. Some harsh words, some soft words. So many vocabularies we got in Media from our great masters. That time we may have some, we could not understand that, what they are meant, each word. But whenever we read Bible, I saw that words are there. So I will always take that verse and that proverbs they used many times. It may help a lot. So I take always. I saying some words, a gentle answer. We know that when there is a quarrel, some people may say 1 or 2 words. It will clear the situation. It will change the situation. But someone, when they are talking, the time, the problem will be more and more, and it cannot be controlled. So everything is coming from a mouth. That may sometimes it may stir up problems, but some words from some people those who are having that charisma, they say a few words and it will quiet the whole situation. Once I saw in my classroom, there was one teacher, one Savitri Amma. And now I remember that day. There was a great frustration in our classroom where quarreling, bombarding voices are. That time, only the teacher, he was a great personality. He just peeping through the door and everybody becomes quiet. That's the power of some people. They can control with just a glimpse of look that make that situation all change. Just I am saying this because as a doctor, you know that neurology and psychology is very much interrelated. We know that one is functional form, one is the bodily parts. Some people may say that while seeing the doctor and all the complaints are reduced a lot, subsided. How it is happening? Is there anything, if they are saying this, somebody says that is this only psychological factor? No. There are hormonal changes will be there. Now we completed our cranial nerves, oculomotor, this 3 completed. Oculomotor is also completed. And now cochlear, 4th cranial nerve. Today we are talking about cochlear nucleus and cochlear nerve. Fourth nerve. We have completed auditory, olfactory, auditory, optic nerve, and oculomotor. And now we are coming to cochlear nerve. Fourth cranial nerve. The function. The cochlear nerve is responsible for the movement of a single eye muscle, the superior oblique. Its primary functions include depression, moving the eye downward, intorsion, rotating the top of the eye towards the nose, abduction, moving the eye outward to a lesser extent. Anatomical pathway. These are the functions. We can raise our moving the eyes downward. There is some exercises in the yoga, they train. These eye exercises there are so many eye exercises in yoga. They are rotating the eyes clockwise and anti-clockwise and upward and downward. And these are the muscles. Last time we oculomotor nerve had a lot and cochlear nerve. These are nerves whenever we do that exercises, that muscles will be more powerful, more active. Sometimes if we are not using force, we are not doing that exercises, that muscles will be weakened. If the one side is weakened, then the eye will go in a different way. So we can see that some persons, while they are traveling or walking, they tilt their head sometimes to see the thing. This is because of this nerves are not working properly. They have to adjust their body, their physique to that to concentrate or to fix that object. Otherwise, they cannot see that thing in a good in the normal vision. They will not get. So they have to adjust their eyes. Because of its long and complex route, trochlear nerve is particularly vulnerable to injury. Origin arises from the trochlear nerve nucleus in the midbrain, because the nerve fibers cross over, meaning the right nerve controls the left eye and vice versa. First, it wraps around the brainstem, passing through the cavernous sinus and enters the eye socket as a superior orbital. We can see this. There is chances of trochlear nerve. Trochlear nerve, the fourth cranial nerve, damage or compression to the nerve results in trochlear nerve palsy, causing vertical diplopia, double vision. Vertical diplopia, the part we can see in double vision and vertical, which is essentially noticeable when looking down and inward. Why they are looking downward? That time, diplopia. Diplopia means that last time I told you many photographs of it, images of it, that there is a blurred vision, or sometimes it is two vision will be there. One eye concentrated, one is focusing on, and the another will focusing the other. Compensatory head tilt. Patients typically tilt their head away from the affected eye to compensate for the vision misalignment. This is what I said. They are tilting their head to and fro, and sometimes they will go on side. Common causes. There are so many causes are there. The common causes are head trauma, diabetes-related microvascular damage, congenital malformations, and increased intracranial pressure. These are the four main things. If the child, whenever there is getting some children, the patients, small children, they may tilt their head to see the things. That means that there is trochlear nerve problems. And after that, the congenital malformations, if there is no congenital malformation, there is chances of head trauma. Every head injury is a serious one. So we have to give some medicines for head trauma. The main important medicine is head trauma is natrum sulph. We can use 1 10 or CM potencies. Any head injury, we can blindly give any of these potencies because it may give some very much give it useful in such cases. Normally 10 natrum sulph 10 and arnica. Calcarea carpis also can give if there is any hemorrhage in the brain hemorrhages. That time it is very much useful. And nerve trauma, hypericum 1 10 hypericum. In some cases, any injury, any nerve injury, we can give hypericum. And another medicines, there is natrum force. We know that the phosphates, very much useful. The 5 forces, ferrum force, mat force, natrum force, calcarea force. These are all the medicines we can, the teacher's remedies also we can give in such cases. It controls the nerve, controls just extraocular muscle, the superior oblique muscle, then actions responsible for the depression, I said always, early abduction, outward rotation, and intorsion, inward rotation. The both eyes, external rotation and internal rotation. Fun fact, while it is the smallest of all cranial nerves, it has the longest intracranial pulse and is the only cranial nerve to emerge from the back of the brainstem. This is the smallest of all cranial nerves. While it is the smallest of all cranial nerves, it has the longest intracranial pulse and is the only cranial nerve to emerge from the back of the brainstem. Next, clinical testing. To isolate the trochlear nerve during an exam, a healthcare provider asks you to look down while your eyes is abducted, looking towards your nose. Sharply, looking towards our nose. That is one of the tests. Damage to this nerve most commonly results in vertical double vision. We can check in our clinics that they have to close their eyes looking towards that root of the nose. That time, if there is any double vision or vertical double vision, we can say that the nerve is damaged. So exercises are more useful. In addition to giving the medicines and tissue salts, exercise is more useful and it will clear the case. What is the smallest nerve in the body? The smallest nerve in the human body is the trochlear nerve. Size, it has the fewest axons of any cranial nerve, making it the thinnest and smallest. If anybody asking in the examinations, this competitions, you can say trochlear nerve, the cranial fourth nerve, has the fewest axons of any cranial nerve, making it the thinnest and smallest. These are the vision. We can see that there are some eyes not in a proper way. There is an equilibrium of the muscles while they are all fixed in a normal way. Whenever there is any changes, that time this eye position will be changed. Eye positions will be changed means the vision will be double. Is the nerve. Here we can see that two eyes. One eye is straight, the other eye is slightly turned to this side. Here also like this. It is in children. Here we can see that eye is looking upwards. Yeah, if in childhood we say that if they are instructed that they have to do that exercises, naturally it will become more and more corrected. We can correct the cases. There are another operations are there. They are correcting the muscles, and in addition to that, we can do the exercises we must do before that going to an operation. Trochlear nerve disease primarily affects cranial nerve, for which controls the superior oblique muscles used to look down and inward. The most common condition is known as trochlear nerve palsy. This damage causes double vision and leads patients to tilt their heads to correct their sight. Major trochlear nerve disorders, a few conditions can impact the trochlear nerve, also known as the cranial nerve, resulting in abnormalities in eye movement. Here are some noticeable trochlear nerve disorders. Trochlear nerve palsy, this disorder affecting the trochlear nerve typically occurs due to head injuries, nerve damages, or congenital factors. It causes difficulties moving the eyes upward. Moving the eyes, it causes difficulties moving the eyes upward, leading to vision and other visual disturbances. Another thing is trochlear nerve stenoma. This tumor can affect the trochlear nerve and may result in neurological symptoms. Trochlear nerve compression, when structures or tumors nearby compresses the trochlear nerve. It can lead to dysfunction, cause problems with eye movement. Trochlear nerve neuropathy refers to conditions or diseases that affect the trochlear nerve. This condition can cause weakness or paralysis of the superior oblique muscle. Tumors. There is only a few places are there. The pressing means everything will change. If there is a tumor in that areas, you know that I will show you that areas. If there is any tumor anywhere can come. So that tumor pressing the trochlear nerve may changes the vision and the knowledge. Congenital trochlear nerve disorder, some individuals are born with abnormalities of the trochlear nerve, which can result in eye movements, which is from birth. Trochlear nerve injury, trauma, such as head injury, surgical procedure or surgical procedures can lead to trochlear nerve injury and subsequent eye movement problems. Now, we are passing to the fifth cranial nerve, trigeminal nerve, an important nerve. The largest cranial nerve, the shortest we already studied, that is the fourth cranial nerve, trochlear nerve. Now, the trigeminal nerve, the fifth cranial nerve, that is the largest cranial nerve, responsible for facial sensation and controlling the muscles used for chewing. It divides into three main branches: the ophthalmic branches, maxillary branches, and the mandibular nerves. Very much important. It's a very much important muscle and nerve. It is the longest, largest cranial. It is supplying the most of the facial areas. Ophthalmic area, maxillary area, and mandibular area. B1, B2, B3. There are so many branches. It has so many branches. We can see here, ophthalmic, here going this areas. Trigeminal nerve, the second, that is maxillary nerve, that gives here, and the mandibular, B3. Make it your images, your mind. Then there are so many cases are coming in that way. Most of the cases are having some relationship with the trigeminal nerve. This is an important nerve. The dental area, facial nerve, facial muscles, gums, mandible area. These are here only studying this in dentistry, they can do everything. Because nerve blocks, there are two types of infiltrative method and two types of anesthesia they are using. They are infiltrating method and complete block method. They are putting that injecting the medicine or the anesthetics, anesthesia to here. There are no nerve block and infiltration method. That means sometimes they may inject any place of it. It may infiltrate the other place and give numbness. It uses in taking the all operations in the dentistry. We completed olfactory, optic, oculomotor, cochlear, and here comes the trigeminal. Now, is it visible my screen?
Yes, cranial.
Okay. Nerve 5, known as the trigeminal nerve, is the largest and most complex of the 12 cranial nerves. It is a mixed nerve, meaning it provides both the sensory information, pain, touch, temperature from the face, and motor control, movement for muscles involved in swinging. Emerging from the pons region of the brainstem, it splits into 3 primary branches. 3 primary branches already discussed. Ophthalmic branch, mandibular branch, and maxillary branch. Almost whole area, half of the whole area. Trigeminal nerve diseases affects the 5th cranial nerve, which controls facial sensations and swing. The most common condition causes severe facial pain, muscle spasm, or numbness. These diseases and disorders are generally categorized by the symptoms. They cause painful trigeminal conditions. Trigeminal neuralgia, a chronic condition causing sudden, severe electric shock-like or stabbing facial pain. Sometimes we may be misguided that this neuralgia and migraine. In migraine, it is happening inside the brain, but here is something more on the face and areas. Severe electric shock like stabbing facial pain. Classical caused by blood vessels pressing on the nerve. Secondary caused by an underlying disease like a tumor or multiple sclerosis. These are the main 3 conditions. Trigeminal neuralgia, the blood vessels, sometimes the blood vessels may be engorged and the size of the blood vessels will be more and it may press the nerve. And we know that there are only a few spaces are there. If there is any inflammation, it may affect the whole area. And the other caused by underlying diseases like a tumor or multiple sclerosis. Tumors, gum tumors, cancers, benign tumors and malignant tumors, infections of the gums. If the conditions, if there is anything, any painful condition, it may affect the whole area. Sometimes it may be inside the ears. That may affect the whole area. Sometimes in the gums, it may affect the whole area. That person, it is a general symptom, like a general symptom. We call it as a general symptom. How to block out pain? This is one of the main things. How to block pain. Blocking out pain is an important thing in treatment. Blocking out pain involves a mix of physical interventions, mind-body techniques, and medical options. For immediate relief, use the RICE method. RICE. Rest, ice, compression, and elevation. That is rise. Rest, ice. Whenever there is pain, we will put some ice on that area. If there is bleeding, we will put them ice on that area. Rest, compression. Sometimes the compression may give elevation. For injuries or try mental distractions, persistent pain often responds best to professional medical strategies and therapy. Others, we know that medicines, giving medicines. What are the things? We just think about what are the things, what are the problems that may create the pain more tolerable. That time, there are some other reasons also there. Even though there are some problems, and in addition to that, some hormone imbalance may cause nerve pain. That may increase the pain, aggravates the condition. Yes, hormone imbalance can absolutely cause nerve pain. Hormones regulate critical nervous system functions, including nerve cell growth, repair, and pain and signaling. These are all needed. When specific hormone levels drop or spike, they can inflame nerves. Inflammations will be there. For most inflammations, we use that medicine. What medicine we will use? Belladonna. Belladonna is the number one medicine for inflammation. And calcarea car, another medicine. Arnica, hypericum. These are the medicines. Pulsatilla, one of the main medicines for inflammation, pulsatilla. In girls and in ladies, in their menopausal area, if there is the hormonal changes, let us go there. Decrease blood flow or cause tissue swelling that compresses nerves. These are the other conditions that may elevate the conditions more. Common symptoms: tingling, numbness, or a pinch and needle sensation. Burning or electric shock-like feelings, unexplained, persistent, cold hands and feet. Cold hands and feet, that means reduced blood. Increased pain sensitivity or joint and muscle aches. The normal painkiller. Which is the normal painkiller? Endorphins are your body's natural painkillers. They are special chemicals made by your brain. When you feel pain, stress, or excitement, your body releases them to block pain signals and make you feel good. Endorphins. Endorphins. This is the main point I want to express you. Endorphins are your body's natural painkiller. We should know about it. There are 20 types like endorphins. They are special chemicals made by your brain. When you feel pain, stress, or excitement, your body releases them to block pain signals and make you feel good. If there is more endorphins, how to produce it? Let us go there. Primary hormones that cause nerve pain are the insulin, the most common hormonal cause of nerve pain. Diabetic neuropathy occurs when unstable or high blood pressure, sugar damages peripheral nerves. Estrogen and progesterone. If the estrogen production is lessened, that time, ladies in the menopausal time, these are all reducing that time, these conditions will be there. Their pains and always, they have problems, everywhere problems, in the knee joint, whole body may be affected with estrogen reduction. Fluctuations during menopause, perimenopausal menopause, or the menstrual cycle can increase pain sensitivity and cause tingling, burning, or numbness. Here, sepia, pulsatilla, other medicines. The thyroid hormones, low thyroid levels, another pain making factors. One, estrogen reduction, thyroid hormones reduction, low thyroid levels, hypothyroidism, slow metabolism and blood flow, which can starve nerves of vital oxygen and nutrition, leading to neuropathy. Starved nerves. There is starvation of the nerves. They will not get the proper nutrition to develop or to restore, repair their nerves. That time, these are one of the major conditions of thyroid hormones, low thyroid levels. Hypothyroidism slows metabolism. You know that? It slows metabolism and blood flow. During that blood flow is lessened, which can starve nerves of vital oxygen and nutrition, leading to neuropathy. Next is cortisol. Chronic stress disrupts cortisol levels. Stress, which increases inflammation and impairs the body's ability to repair nerve damage. If there is any inflammation, we cannot clear it. The inflammation must be reduced. Then only we can get a healing process will start. Next is testosterone. Declining testosterone levels in aging men are often linked to increased joint and nerve pain. Now we can see that these are the pain. Why we may say that there is pain for going the age more and more, aging more, that time all complaints will be there. So we should think about it whenever we are treating older patients. These are the factors we should go through. Idiopathic pain with no clear cause. There is no, we cannot say that which is the cause. But we should consider all these things. If there is any problem in the nervous system or the hypothyroidism or these are all should be considered while taking a case. Post-therapeutic neuralgia, nerve pain that happens after a shingles, herpes zoster outbreak on the face or forehead. Now, there is a season for chickenpox. Whenever the chickenpox are seen in the nerve areas, long, one-sided, most of the cases, it is, I think that it is one-sided, herpes zoster. After chickenpox, otherwise it is called shingles outbreak on the face or forehead. This is one of the reasons of neuralgia. A type of facial headache pains associated with a spinopalatal ganglion, a cluster of nerves linked to the trigeminal system. Call it as Slater's neuralgia. The medicines, main medicines we are using are creosote, plantago, thuja, pulsatilla, and hypericum. Hypericum, almost all, from mother tincture to higher potencies. Trigeminal neuropathy, any condition that damages trigeminal nerve causing numbness, tingling, or weakness instead of sharp pain. Causes include facial trauma, diabetes, or infections. Diabetes. Diabetes is a main reason for trigeminal neuropathy, and there is conditions. We know that gums are more affected with diabetes. The loosening of the teeth. And we have to, most of the cases, we have to remove it. Helpless. So diabetes mostly affected on the gums. Numb chin syndrome, a numb feeling in the lower lip and chin. This is an important warning sign that can indicate an underlying malignancy or tumor. These are the other factors. Pain with no clear cause. We should consider all the above said things. Post-therapeutic neuralgia. No, these are all I told you. And make it in mind. Keep it in mind. Expanding pain. How the areas may affect it. Can you see it,
Yes,
doctor?
Yes,
Okay.
yes, see.
Endorphins. We are now going to how to make it. Our painkillers, how to endorphins are the primary natural pain produced by the hypothalamus and pituitary gland. These neuropeptides bind to the brain opioid receptors to block the perception of pain, reduce stress, and promote a sense of well-being. Here types. Endorphins. The body produces over 20 types of endorphins, but the most prominent are beta endorphins, the most potent natural painkillers and mood enhancers. They are heavily associated with the runner's high. Enkephalins, dynorphins, additional neurotransmitters that modulate pain perception and emotional states. Here, what happening in homeopathy? Homeopathy works here. Immediate pain relief. Whenever we give medicine in mouth, in tongue, immediately pain will relieve. That is happening because immediately agitate the endorphins. It is in the pituitary hypothalamus. Agitate the hypothalamus and immediately it will affect. That is how whenever we are giving some, they are using some ganja. That time we give Naxomica, immediately the effect will go. Ganja, we know that cannabis indica, cannabis. If taken smoking for ganja, immediately give Naxomica 2-3 drops, and it may vanish the complaints immediately. If there is any bite from the styes, that honeybee or like that, insects bite, epismell. It's a very, very effective medicine. Epismell and Naxomica, and yeah, we can use this pyrogen, another medicine. Medicine. How they work? We should understand that. How they work. Endorphins, how they work. When you experience pain or high stress, nerve cells send pain signals to your brain. In response, your body releases endorphins to intercept these signals and prevent them from reaching pain. Pain receptors. Another thing, how to boost them naturally. You can naturally stimulate the release of these painkillers hormones through several activities. One is exercise. Sustained aerobic activity, walking, running, or swimming at a moderate pace is one of the most effective ways to trigger an endorphin release. How to trigger it? Laughter and social bonding. Always laugh. Laughing, having sex, and eating enjoyable food can naturally spike endorphin levels. That is why I am always laughing. Mind-body practices, meditation, deep breathing, yoga, and acupuncture trigger pressure points to help. There are some pressure points in our body. Help soothe the nervous system and manage pain. Once, it was in 1986. That time. I was in a remote area. I was practicing just after finishing my medicine. I was started there. And that time I used to do Shirshasana, head down position in yoga. Because that time I used to smoke and I am not proper. While doing this yoga, we have to clear the 9 holes of our body. That is what they say. We should clean our bowels, our urine and everything. The daily routines all should be done before doing exercises in yoga. Whenever we are doing yoga, we will not exhausted. We will not be exhausted. But in physical exercises, we will be exhausted. And doing yoga for hours, that may give you more and more happiness and ease position in your body. That is what yoga doing. Here, I did it. That time I have some problem in the chest, and immediately I fallen down, and I could not stand because I was growling like something. That time I went to in the evening. This happened in the morning, and I took some homeopathy medicine, and in the evening I could not even move. That time I went to nearby. There is a Marmani. We call it as Marmani, Ayurveda physiotherapist. He immediately did some massages on my body, and immediately the pain all gone. I was wondered how it is happening because the pain is inside. How he did it? That time I asked him. That time he said that every knots of the inner part will be in the outside. That is, we have to agitate that area. So I think that the time is okay. Now I am stopping here. Okay, you are.
We have 5 more minutes. Dr. Sridhara Kurup has already raised her hand. Doctor, please. Please unmute yourself.
Dr. Hubert, it was very nice and excellent session. It is very informative and scientific. So thank you very much. So I like to add 1 or 2 things that for immediate relief, Plantago external application will help. And you said that Naxomica is also helpful for antidote, the cannabis, but camphor also very good for that. Camphor also immediately, because most of the houses, especially Hindu houses, camphor is easily available. 1 or 2 pieces of camphor you chew, it will antidote. Thank you very much. Come again with a wonderful session. Thank you very much. I simply saw that what is going on, then I saw you were, so I was sitting continuously. Thank you very much. Come again.
Thank you, sir. From your words.
Thank you so
Great
much.
words, sir. Thank you, sir.
Thank you, Dr. Sridhara Kurup, sir. And thank you, Dr. Hubert. You are really collecting all the information about the nerves and making it as a slide and teaching us. It's a great struggle. every information about the nerves you are giving here. Thank you so much. And even though it is suddenly we are sending you message to take the class, you are prepared. Everything, the PPT, everything is prepared and ready to take the class. All the time ready, like hotels when they are they don't need any preparation to give. No, Dr. Danesh and Dr. Ram Parveshwar sir already raised hand.
Yes, Dr. Bob Lim also. So we can invite Dr. Bob first, and then we can ask Dr. Rams Parisa sir to say what of thanks.
Okay, Dr.
Thank you,
Bob.
Dr. Danesh ji. Congratulations, Dr. Hubert Salva. Very nice, excellent session. Everyone, namaskar. Manoj ji and Dr. Krug sir is the as a guardian. So, De Silva is a emergency medicine for so, our interesting describe the nerve.
Instant
Interesting.
speaker.
Or the trochlear nerve. Very large scale describe the nerve. A main cause of disease according to nerve, mind consulting nerve. So very thanks behalf of IFPH whole team. Very thanks. Moderator Dr. Saila, Dr. Manoj ji, Dhanesh ji, everyone, whole team. Very thanks, Dr. De Silva. Thank you.
Thank you, sir.
Thank you, Dr.
Again,
Ram Parveshwar sir.
presentation, Gargar Homeopathic, Homeopathic.
Thank you, sir. Now I am inviting, we have 1 more minute. I am inviting Dr. Bob Lim. Dr. Bob Lim, are you there?
Yes, doctor is there. Yes, Dr.
Yes,
Bob.
can you hear me?
Yes.
Yes.
Okay, I would like to congratulate Dr. Hubert for being our lifesaver and parachute for tonight's webinar, because we are supposed to listen to an interesting subject goes through. But anyway, he has come out with a very detailed presentation of neurology by Homeopathy, which cover a wide range and the scope. And it is awesome for him to do it at the last minute. And I'd like to appreciate our gratitude and thanks to Dr.
Thanks,
Hubert
sir.
for
Thank you, sir.
conducting tonight's webinar. Thank you very
Thank-
much, and over to
Thank
you,
you.
Dr. Ajini.
Thank you, Dr. Bob Lim. Your voice was fluctuating and it's not clear, even though I know that you are appreciating us in all the way. Thank you so much for your appreciation and presence here. Now it is the time to wind up the
Dr.
session.
Ajini, an announcement for tomorrow.
Okay.
Tomorrow we will have a session from Dr. Yashika Arora Malhotra. She is the Senior Research Fellow CCRH, and she will be talking about a role of homeopathy in nephrology. Nephropathy.
Thank you, Dr. Danesh, for the announcement of tomorrow. And now we are moving to the Malayalam session. For moderating Malayalam session, I am inviting Dr. Manoj or Dr. Shaila. Who is moderating? Dr. Shaila. I'm inviting Dr. Shaila for moderating Malayalam session. Thank you all the participants of the English session. See you the same time tomorrow. Bye-bye, good night. And I'm inviting Dr. Shaila for moderating Malayalam session. Thank you, everyone.
Thank you all. Thank you.
Thank you, Dr. Ajini. Thank you, Dr. Hubert.